Okay, so evidence-based practice, it's a relatively new thing for me. I think I considered that I was experienced up until lockdown, and then all of the it's not so much new, well, it is new information around working from an evidence-based approach, evidence-informed rather than evidence-based, because we can't evidence everything that we do. Massage isn't well evidenced, as we know, but it just completely transformed my practice, I would say, just with this new narrative around what we say, what the outcomes are that we're getting from our treatments, what the treatments are doing. And it was a bit of a wake-up call, to be honest. And I know it's been quite controversial for some people. A lot of people have struggled with this new narrative. I kind of embraced it and took it on board. But I know, yeah, for a lot, it's been a hard process, but I think that it's a positive step for the industry. Yes. And it's a really important step for the industry. And I think that if we can all embrace it to some extent and try and incorporate it into our practice, I think that's where we need to be going, really. And that's my feeling around it.
Yeah, I like that, actually. And you said something quite important to me. And to me, it's one of the things, one of the statements I was going to say, you know, what does evidence-based practice means for us? One of the things it means for us is about the new narrative. And why that is important is because, again, evidence is telling us that some language, some words that we might used to use because we knew differently might not be as conducive to positive outcome for clients, you know, for clients feeling better. And that to me, the narrative is one of the absolutely major part of it. Yes, I know that, you know, sometimes you think, oh my God, you know, I thought massage worked in this way, but actually massage, you know, now we find that evidence is telling that it might not actually, the effects of it might not be as we thought. But it doesn't mean that it doesn't work. You know, it doesn't mean that the effect is not there, but, you know, changing the narrative is really important. And there's, you know, and that is, to me, is one of the biggest part of evidence, being evidence-based. And I love the word that you used, evidence-informed, because it's not all the time, you know, we're not gonna always be able to follow RCTs. And indeed, there is a group of researchers called, well, from all over, from I think it's Finland and from Southampton, and they put together a project called Cause Health, and it's so beautiful. I put the link out there, because what they're describing, they're describing the limitations of evidence. So when we are studying the human being and healthcare, how can you use, you know, the complexity is so big that actually you cannot take away that complexity, that person, the individuality of the person into consideration. But taking the individuality of the person into consideration then means that it's not as a rigorous study, RCT, as it should be. And that raises a lot of questions. So what the Cause Health is saying is that, yes, we need to look at RCTs, we need to look at evidence, but also should we actually ask different questions? Should we actually change a little bit the type of studies we do? And in fact, what they say, well, one of the researchers there said, they did, that Oliver Thompson did some amazing podcast on that. And what they said, he said, clinicians should be looking more at evidence, but also evidence should be asking clinicians the right questions to ask. Sorry, my head scarf is going. So should be asking the right questions. So the researchers should be using clinicians' experience to inform their research, which I think is really, really valid, actually, to me.
And it's valuable as well, isn't it? Because experience goes a long way as well, because you get to get a feel for how people respond to treatments. And
yes, sorry, I stopped you there, but people come in. So this is one of my other big point I wanted to say tonight. It was that I was going to start it with, what is evidence-based practice? Evidence-based practice has been identified as, Sackett identified it as using the best available evidence together with clients' values, clients' needs, and together with clinical experience. So that when we make that decision for that particular client, the type of treatment, what we do, we actually take that decision making from what does evidence tells me is the best approach for these conditions or injury. What are the client's preferences? And what is my clinical experience teaching me also? Which I think we forget sometimes. So we forget because sometimes we think evidence-based practice is just what the study tells us. It is more complex than that. It's a lot more complex. But I think as practitioners, you will all agree that we are so often we give a lot of priority to client preferences and to our own clinical practice. Says, oh, I've been in practice for 20 years and I've seen that been working. I think we need to start now to give importance also to evidence. So I think
on the computer. Okay, can you hear it?
Oh.
Oh.
So Lucy, I just muted you, darling. I just muted you. So that's what I think that there is more value, and I think it's the right time, and COVID brought it in, that we need to start looking a little bit more what evidence is telling us. And I think it's favorable to us, because what it's evidence, I'm talking in the general terms of, I'm talking about healthcare more than just particular, because here probably we got massage therapists and all other practitioners. What evidence is telling us that we need to take into consideration more than just the person physical injury, for example, and that is something that is very important. So to me, if asked the question to me, what it means, what is one of the priority, the major elements you consider when you talk about evidence-based practices, to me, is learning about pain science, because that changes completely my attitude towards my client. And knowing that client that comes to me with a shoulder pain, for example, for me to assess it or treat it, and I know that the shoulder pain is not only, and we all know as holistic therapists, I was trained as more of holistic therapies, as holistic therapists, we know very well that we call holistic, that, a pain or injury or suffering of a person is more than just what that shoulder injury might be in the case of a shoulder. So that for me is really important, and now we put that into practice, that's for sure. What somebody else is, so what in your case do you see as evidence-based practices in massage therapy or in your own profession? How do you see that? Or is there any question you might have that you want answered? I wanted it to be a really nice, relaxed chat.
I can say what it changed for me, like without the things what you mentioned already. So for me, it opened conversations, different conversations with the clients.
Yeah.
It made me question, and it made them question things, because we all have that old narratives, and then I'm not pushing my opinion or science to them as such, but it's did you ever think why? Like, did you ever thought like things like that? Or I don't even know, like, when we all come like old story, like, oh, I go to my chiropractor to get like my hips realigned, like, yeah, I go there every 6 weeks. I said, did you ever ask why do you go there? Did you ever ask? He said, I didn't think about it, like, you know. And I said, does it make sense to you? How long it lasts, that good feeling? As you say, oh, like few days, but then I need to wait for another appointment 6 weeks. I said, like, did you ever thought that you can do something else on it, like things like that? So it's open conversations. I never talked with them in that way like I was before.
Indra, well, yes, again, it's really, really interesting from my perspective, because again, you know, all our therapies, you know, and we all, you know, our clients leave our couch or our room and they feel better.
Yeah.
And for me to even, you know, I think you're raising a really good point there. For me, just to make them aware that you're feeling better for different reasons.
Yep.
You're feeling better because we know nowadays that they're feeling better. It's non-specific. It could be because the treatment, you know, like in example, massage therapy is one of the best pain modulators you can have, because when you massage somebody, especially, you know, light strokes, so you're stimulating C-tactile fibers, the person feels so good, they feel really relaxed. That in itself is a pain modulation. So I say to them, you actually, why you feel better after the treatment is so many things, more than once. It could be because actually of the massage itself. It could be because you trust me. It could be because actually there is, you know, natural history of your injury. There is because actually you particularly like the depth. There is because you like the music.
Yeah.
You know, it's so multifactorial. The important thing is you come out of here and you feel better. But even more important than that, then to them to understand that they do not depend on you for them to feel better again. So to me, you raise a really good point. I love that people choose to go to different therapies.
This is
I
it.
love
Yeah,
people that
like
choose.
it too.
Yeah, but that's where Sarah mentioned about the narrative. They need, I think we need to be very open and honest to say why they feel better.
Yeah, this is
I often say to them, it's not because I actually frictioned your shoulder.
Yeah, exactly. So like the questions why, and I do like a majority of my clients, like we say, we come with the pain, and I say, and I said, normally I said, here you go, you're here with me. What do you expect? Like to feel better. So that's the half of my job done. You already came with the good expectations, because you know we have when you go to doctor, yeah, like I go to the hospital for some tests, that you know that it's something you already expect. Oh my God, we're gonna find something. This is going to be bad. Like, you know, they already have that fear, and we don't have a fear coming to places like ours, do they? So half of my job done. Thank you very much. Like, you know, we can get some things done normally. Like, you know.
Yeah.
You do get it, you know, and you just calm things down, and then you just work with them, and you don't have. How many of your clients came out feeling bad in all those years you worked? I don't, like, worse than we came in. I actually don't remember none. Like,
Yes. Again, you know, so what does evidence telling us about our treatments? Well, actually, we know that works is the therapeutic alliance. Therapeutic alliance is a term that is used mainly in psychotherapy, and actually nurses. I believe in nursing was used to be used, and there are a lot of research through nursing. So that's what it means also being evidence-based practitioner. So you look at those the evidence, and especially the nursing evidence, psychotherapy, that they show that therapeutic alliance, a good therapeutic alliance is they trust you, great communication skills, great listening skills. By you establishing that underpinning relationship, we know already that there will be better outcome to the treatment. And that to me is really important, because to me it actually valid. When people said, when they you know, Sarah mentioned it, she said, you know, for some people it's been really difficult to make the switch to be evidence-based practice. To me, all of a sudden,
it was hard.
Yeah, well, to me, all of a sudden, and I know all the others, please comment, but it is very it's been enlightening, because as a holistic practitioner, as a massage therapist, we knew that when the client come in and, for example, they are on the couch face down, they tell us things that they would not tell otherwise. So we give them that time, we give them the listening ear together with our hands, so they're able to actually express themselves, express about their experience in this case of pain, and then they experience actually, you know, how many times you heard that, you know, they say, oh, they come in with a frozen shoulder, but actually then you hear that 2 or 3 months previously they might have lost a husband. You know, straight away they're not going to tell that. So that communication, that and the therapeutic alliance, we know that is fundamental. That's, if you say, you know, how do I start practicing evidence-based practice? A lot of, I'm going to mute you a moment, Indre, because it's quite a bit of noise. That, you know, if you say, you know, one of the things, one of the strategies you can start putting a bit more importance on, it's that therapeutic alliance, because we know that has better, makes the outcome of the treatment much better. What is, can I ask the question out there, what is your understanding or experience or concerns or comments about this last year evidence-based practice being brought a little bit more at your forefront? How have you felt about it? Does anybody else would like to comment? Yeah, so you don't need, talk over, talk, unmute yourself.
I'm good with technology. Hello.
Oh, yeah, the same here.
I think in many ways it's very overwhelming and quite daunting. And I mean, I'm quite old school. I'm waving hello to Lisa right there, because we've known each other for ages, about 20 years. And I was taught as a beauty therapist many years ago. And, you know, we learned about knots, we learned about too many acids in your muscles, hence you got your crunchy bits.
Me too.
And it's saying it with confidence and saying it, I think, with truth, and so you're not, you know, disparaging anybody's beliefs. I mean, I had a client today who talked about her knots, and I said, well, here's the really good thing about your back. I mean, she spent about £1,300 on physio, chiro, osteo, massage, and you're sitting there going, oh my giddy aunt. And the first thing I said to her, she's talking about her knots. I'm like, well, the good news is your muscles can't knot. So that's one thing you don't have to worry about. And she's like, really? I said, nah. So that, what's going on in there then? So, well, the answer is actually, who knows?
Yes.
But that's not a problem. But it's saying, as I said, it's with confidence and understanding its value without demeaning the person who's telling you what's going on.
Oh, you know, what you said that is so important. Again, this is another, we know that the lived, I'm using, it sounds like I'm using a lot of slogan words, sorry. That the lived experience that exactly you're saying, we know that it's really, really important. So evidence is telling us that. But this is where I think, as massage therapists, and this is only my thinking, okay, this is not, we have the greatest opportunity to provide the listening ear with our hands for the lived experience. Because think, for example, great that you mentioned about notes. I was going to mention about trigger points, okay? Whatever you guys feel. So what we know about, I'm still going to call them trigger points because it's pointless. I'm going to call them something different. You know, I think it's a nice name, trigger points. But what I'm going to, I'm going to mute. What I'm going to say that when people say, so Anna, what is that? I said, this is what they might call trigger points. It's an area they're irritated. And if it's the first time they feel the pain, they say, oh, but why is painful? It's no reason. It is just, it is an area, we all have it. If I'm going to touch, if I go into a class Every time I go in class, and I teach trigger points, I always say to the students, go and palpate yourself in certain area, and you can be absolutely sure everybody will have that. Everybody will have that pain, but it doesn't mean that you have an injury with it.
Mm.
However, if they say to me, they say, but actually, wow, that reproduces a pain. This is exactly the pain that I usually get in my shoulder. This is exactly the, when I press an area. So yes, because sometimes what's happened, if your nervous system, for many reasons, it could be you're overstressed, you are overworked, you haven't slept very well in the last few days, you're a bit too fatigued because you're overtraining, you can be a little bit non-well conditioned, so you're doing an activity which is actually not, you're not ready for, your nervous system might be more hypervigilant. And because it's hypervigilant, you actually feel in those areas which you have normally, but now your nervous system is a little bit more hypervigilant. That's why you're feeling them a little bit more. That's why you might get in the headache. You might have been getting the shoulder pain. So they were getting away from just saying to that of the not, and we are moving to more of a neurocentric explanation, which is actually the only thing that our clients want. They want to know what is wrong with them. This is, but what our responsibility is to actually try to find the language. And Cecily, you said it's something so beautiful. Actually, to say, yeah, you really did. Actually, to say, we don't know.
It's difficult saying it though. It really is, and you feel kind of guilty that you don't have an answer.
Yeah, because you think that the client doesn't trust you, but actually, when you say, we actually evidence, there is so much, studies being done over, we still do not know, because the body is very complex. But what I know, that, for example, somebody comes in, I keep saying about the shoulder, that this is not dangerous. What I know, that this is, those are not red flags. But actually starting feeling reassuring them and feeling comfortable with the uncomfortable is so much better. Because from the other perspective is, if we say to them, let's think about any old narrative, this is tight because, like you say, you go and not. Straight away they feel really good, don't they? They come out of the room because, of course, they feel good for all the reason we explained. Of course, they feel good. They feel good because we touch them. They feel good because they trust us. But then every now and again, that they have the little bit of shoulder ache, what are they be thinking about? I got a shoulder problem because I got a knot. And the knot can only go if I go and see Cecily. Sorry if I'm not pronouncing the name correctly.
No, it's perfect.
Yeah.
Spot on.
And that we know that is not good, because we know that doesn't build self-efficacy. So that makes them dependent. I have clients that have been coming to me for, I kid you not, a decade, but not for treatment of an injury. They're coming to me because actually they choose to come to me just for massage, because I've become part of the health journey. So what I say to them, I don't call it maintenance. I used to call it maintenance. I moved away. And I say to them, they choose. So let's say I'm treating, again, this shoulder. And I say, look, your shoulder treatment, I am quite happy. Didn't need to refer. The shoulder problem went. The person is stronger, can go and play tennis again. Great. So I said, our treatment is finished. However, if you want to cut, and this is why I think from a business perspective, it's great. We can provide massage, which is and I'm not embarrassed to say, it's a pleasurable experience. It's a very positive experience, which I think is totally underrated nowadays. And actually say, you can continue to come to receive massage therapy just for the benefit of feeling good, the benefit of feeling relaxed, of feeling your muscles relaxed, the benefit for feeling your range of motion free. obviously, you know, and I build up on the good narrative so that they know that they don't depend on me. So that when my runner didn't get the massage before a Brighton Marathon, she doesn't, you know, do a terrible time on the Brighton Marathon because she thought, oh my God, I didn't see Anna, and therefore my timing is gonna go off. That's why there's another thing, there's another element, you know, one is language, one is therapeutic alliance. The third element, let's not create a dependency. But we don't need to. We don't need to, because unlike other professions, and I don't know much about reflexology, so forgive me for that, but I know about massage therapy or soft tissue therapy, that is my profession. People come back to me just to have a massage sometimes, and that for me is very good. In fact, I totally support that, because what, again, we know that if we go back to, I'm not going to bore you with pain science, but if you want to, I can pain science. So what we know about pain science is that the person injury, if we're talking about the person pain, lived experience of pain, it's influenced by the person emotional, psychological, and social well-being. So if the person, they enjoy the massage, one of the things that we know by evidence, absolutely clear, that massage is evidence to help with anxiety and depression symptoms. So if somebody comes to me regularly for the affective, AFF type of word, affective treatments, I query if that by keeping their anxiety at bay, or helping them to keep their anxiety at bay, I might help the lived experience of pain to be kept a little bit at bay as well. But that, you know, what you said there about the lived experience is, and this is where we are perfect, because we're there to provide them a safe environment to speak about the lived experience. But we need to be comfortable and know, because ultimately telling a client, you know, yeah, actually, massage doesn't break down scar tissue. They don't mind. They might say, oh, but I heard it from Men's Health magazine, you know, that they break down scar tissue. Yes, I know, this is what we thought, because it was, you know, it sounded quite plausible, but now that studies are becoming more rigorous and we've done better evidence, we know that it doesn't happen. We don't know yet what's happening when we put hands on people, but we know that it is more of a neurocentric, you know, a neurological effect, as well as effects which are, you know, the relationship with the client, which is the language, and it's the complexity of it. And you would be really surprised by saying that, how many people will look at you and will say, oh yes, actually, you're right, actually, I was really stressed. Now that you made me think, the hip pain came up when actually I was going through a little bit of a tough time. Because sometimes it's not about you telling them. In fact, I think we should, you know, Bronnie Lennox Thompson, if you don't follow her, please do. She said, what we are there is just for them to join the dots. We help them to join the dots. We just give them a strategy, or we just give them an input, and we help them to join the dots that come out, you know, they themselves, they're discovering within themselves. Because ultimately, and this is, because I am such an advocate of manual therapy, such an advocate. And I'm sure, tell me if you disagree with me, but for those of you who've been in practice a while, you know that there are those people that come through our doors. There is a reason they come to our doors. It's because they want their injuries or pain be treated, or that they want hands-on approach being part of the injury treatment. They want to be touched. And, you know, how many times we hear, oh, the doctor doesn't touch me anymore. How can he know what's wrong with me if they don't touch me? And I could tell them until the how do you call it? The cows becomes blue or something like that, or, you know, kind of.
Come home.
Yeah, the cows come home. No, they might come home blue, but hey, oh, it's beautiful. Oh my God. Until the cows come home, we can say to them, actually, for some conditions, we don't need to touch and do manual testing in order to see what it is. In fact, I looked at some research recently for a course I taught, and it was 90%, 80 to 90% of, this is a research done in nursing, 80 to 90% of medical condition can be diagnosed only by subjective assessment, so not by hands-on. So, but the client still likes it, doesn't it? Because they want to be validated. Don't you find that when the client comes to you and they say, I've got pain in my shoulder, and you go and touch the pain, so let's call it trigger point, whatever you want to call it, you go and touch the pain, to me, not only the neurological kind of effect of neuromuscular effect of pressure, you know, they provide an input and so on, but to me, what's happening, I'm pressing an area that the person recognizes. I'm validating the person pain within, though, a nice environment. My room is nice, got nice music, the person trusts me. Therapeutic alliance, they want somebody to touch it. You touch it nicely, still reproducing a pain, but the pain this time is completely reconceptualized. So I query if that approach, you know, that's why when people says, oh yes, you know, this is exactly what it hurts, actually pressing there and stimulating that experience is a validation that the person lived experience. Because how many times they will say, oh, you know, that's exactly what it was. You seem to know exactly every single point that was painful, and they like that. As long as we provide that with the right narrative, as long as we say those are there, not for the reason you thought they were. And that, to me, that's where the intervention itself. The intervention, the hands-on, is very little. The most important part of intervention is the communication with them. Then actually let them know, you know what, you're strong. You might be going through a really tough time, you know, musculoskeletal, but you are resilient. Your bones are not out of place. You're just going through, and I'm here to help you. And if it is to help you load the tissue a little bit more, to help you reduce the load, to help giving you massage, to help, you know, in hundreds of ways, but actually we're just there to be part of their support. And that, for me, it's really, really important to be part, to validate their lived experience, especially for those people that live with trauma.
I was going to say
that's your hands on, Karen. You go.
That's exactly it, though. It's the way that I work. I don't believe in no pain, no gain. It's all about actually providing that safe space where the client can let go. And it may be in the first session, but it might not be till the 10th session or the 20th session. After building up trust, when the client can eventually feel safe enough, and they don't even need to know what they're letting go of. The trauma will leave when they are ready to let go of it. And the research, the evidence, the neuroscience is out there. It's not necessarily picking up on the touch element enough for my liking. They're talking about all the evidence of the trauma is affecting people like this, and we can do the psychological stuff, but nobody's really saying, you know what, actually it's safe touch. We are mammals, and as mammals we are born requiring safe touch, and then somehow or other along the line we kind of lose that safe touch. And if you look at other mammals, they lick, they cozy up to each other,
social grooming.
Yeah, let's do that. And we have lost that, and we've come to a point where we've either had inappropriate touch, or we've not been primed with the correct touch as babies, so we don't know how to accept it. And so people, oh, I couldn't have a massage. Oh no, I couldn't have that. that's how you heal, actually, is having safe touch with somebody that you trust, so you're not alone.
Again, I mean, this is amazing. Trauma is something that interests me, although I haven't explored into it, but that's my next thing. But talking about touch, the research on touch is growing, and at a very basic level, we talked about it in one of our web chats here with the web chat, the roundtable, I think is called. I mentioned about the touch test that Claudia Hammond, together with the Wellcome Trust, they have created a touch test. It's a qualitative study. I think it was around 40,000 participants over the world. And one of the things they said, you really bang on, that touch, some people don't like touch, but actually some people, they need the touch, and they found that during the lockdown, because part of it, and that gave touch deprivation, and that touch feels pleasant only if you like it, which we already knew, we already knew. But one thing that what you're saying really linked me to something, that when they come in, they have the client that comes through our doors, they're already self-selecting. They will come to us because they already know that they want the touch. So I see very often people that they might just want the touch and they need something more like rehab or strength and conditioning. But I'm not going to go straight to them and say, oh no, I'm not going to give you a massage in this case because you need strength and conditioning, because there is already, there is mismatched of expectation. If we go back to what we said before, evidence-based and client values and therapist experience, my experience is telling me that if I use straight away evidence bang onto the face, because of the previous experience and because the client values is that they want massage, I'm going to give the massage. It's a communication tool first. Secondly, you raise another amazing thing about social grooming. I don't know if you ever heard of Diane Jacob and DNM work with Diane Jacob, dermoneuromodulation. It's a type of technique. I don't mind the technique itself, but it's the way she writes. She writes a lot, but social grooming is one of the big things that she brings forward, because eventually, ultimately, lots of us, we heal through touch. The Tiffany Fields research has shown that, well, we know from previous research that children, especially prem children, that they lack touch, their development is a little bit slow. But Tiffany Fields did another research. I mean, it was not very rigorous, but there is, few research out there that they're all confirming the same, that actually if you touch a prem baby from, immediately and for a certain amount of time, they develop better. So we know that touch has the developmental effect. But also, and to me, from an Italian perspective, okay, I find that sometimes, and please tell me if I am wrong, that sometimes when I say to somebody that I try to talk to them about the multifactorial nature of pain, so that it's not only the osteoarthritic knee, that the experience of pain is also caused by maybe the stress, the lack of sleep, and so on. They say, oh, do you think it's all in my head? Which means that I didn't explain to myself better. But when they say that, they seem to have, they feel that it's not as valuable, the pain. They think that I don't put enough importance in the pain, as if it was just a physical thing. I find that here, saying to somebody, is your emotions also part of this pain experience? They would say, no, it could not be. Like if emotions are something not as important. While to me, when they say hole in the head, that is completely wrong. So it probably me not explaining good to them. But to me, actually, understanding that the pain is multifactorial. It's actually a lot of it is their emotions and their psychology. That for me is as important as if it was from a broken ankle. So that's why we call it also psychologically informed. It's a psychologically informed practice, because we might not have the skills to actually use, psychology into it, but we can start apply more and more psychological strategies to help the client understand, isn't it?
Am I right to talk a sec?
Yeah. Good God, yeah. Just talk over me.
There was a course that I did during lockdown, so I tried to use the time a little bit wisely, and I did mental health first aid. So talking about the psychology of things, I find that really, really helpful, because more that I wanted it because I wanted to be able to happily signpost people that I was recognising issues with to the right place and for the best advice, but also so that I had a better understanding around what was going on with them, and so that I knew like the right language to use. I mean, the best thing that we can do is listen without judging, but I think really you can tap into the psychology side of things by doing something like that. It's a really valuable course that I can really recommend.
That was, yeah, I remember that. Yeah, I think we ought to be honest.
You can do it online. It's so easy to access. Really good.
I think it should be part of our profession.
Yeah, definitely. We always have a moral responsibility for it.
Yeah, what's the mental health first aid one? Yeah, I've done the same too during the lockdown. It was good, really. It's the one you had a test at the end, and it was really proper one. I liked it.
Yeah. So the other thing for me that I wanted to come across, and please join in on anything that you want to say. This is a really free open chat.
Well, I was going to, sorry, Anna, I was going to say just on the mental health thing, I did a level 3 course on understanding mental health. So it wasn't mental health first aid, it was a little bit more in depth than that. And it's one of the best things I did when I was in lockdown, because you start to realise that of all the stigma and the shame and everything that surrounds mental health. And so if we're able to, when somebody comes in for a massage, change how they think about themselves, even if it's a brief moment, then what a fantastic position to be in to help somebody, as I say, even just for that brief moment in time. And you're absolutely right, Sarah. It's about listening and language and just just being an ear and tying that into touching people nicely. That all ties in together. It's such a strong thing to be able to offer as a therapist, I think.
And this is why, for me, when some people said that, I mean, we got messages from people say you're trying to destroy the industry, and on the fact that we are pushing the evidence-based practice, and because probably because we were challenging people beliefs, but I actually don't. I mean, my whole business and life runs around massage therapy. So, but I am one of really strong advocate together with my colleagues, Matt and Becky, about it, because I totally believe that we are so best placed as massage therapists, soft tissue therapists, so best placed to provide a evidence-informed approach to musculoskeletal, and I argue to mental health or to some mental health care, not becoming, I'm not talking about being a counselor or psychologist, using massage therapy as symptoms, modulator possibly under somebody else's obviously supervision, like a counselor, psychologist, or so on. So I think we are so best placed, because what we have to give them, and that's why I think there is tremendous job for us. We have to give them time. I don't want massage therapy to go through NHS. I want it to remain in private practice. I want NHS to focus on sorry, a crisis, you know, to allocate the funding to, you know, what they need to, like the crisis and the emergency and so on. And we remain in private practice where people, we can give them the very important time, the very important touch. That though, it can be detrimental if we do not build up the very important self-efficacy, if we make them dependent on us. So, and also we make them think that the body is not strong enough. Stevie, you know, you said it really, really well, you know, come to us to actually make them feel, you know, make them feel better, because that's what is also just sometimes just feeling good. Because if you feel good, you got more motivation to go out and do the walk that usually you cannot even get out of bed to do.
Anna Maria, going back to the mental health bit, that was a really interesting chat workshop that Matt did last year during the summer, when he was talking about looking at when he looked at that Google Scholar to find when massage papers and research papers were most utilised, and it was in the field of psychology, not in MSK. I mean, that was a great chat that he did about that.
So absolutely. So one of the things we know, we are talking about a body of evidence, not 1 or 2 or 3 papers. A body of evidence says that great systematic reviews. Look at Christopher Moyer. That actually massage therapy has a tangible effect on symptoms of depression and anxiety, mostly utilized. Yes, we have to post the video back up actually, because that I think was really good. So you know, and he's a great advocate of massage therapy for mental health help. But even if it's not mental health, even if it is health, you know, kind of, even people don't have to have a mental health issue, but people appreciate that mental well-being, it's as important as the physical well-being.
Can I ask how many people on here advertise massage as improving mental health? Because I've kind of stayed away from that, just because I don't like to do too many massage can help with this, can help with that. Has anybody actually put their head above the parapet and put that as part of their advertising, that it's positive for mental health? Has anyone done that?
Yeah,
I'm actually a transformational therapist, not a massage therapist now, because I've got my massage plus a few other things in my toolbox that is about dealing with trauma. We've all got our own traumas throughout our lives, and massage is a huge way of safely, without causing pain, helping people let go of the tension in their body that is caused by the stuff that's happened to them in their lives. So therefore, without having to need to be a psychologist, but having an understanding of psychology and knowing how to keep people safe, keeping them in the here and now and not allowing them to be in the past, we can make a huge difference as part of their healing journey. They can obviously be seeing the NHS and all that as well, but self-care for themselves, which does not involve causing any kind of triggering through touch, is so powerful. We all know, I'm assuming, that when people leave our rooms when they've had a massage, they feel so much better about themselves, and they keep coming regularly. Personally, although I couldn't get a massage for 5 months last year and 5 months this year, and I couldn't work either, and that's just as bad because I'm touching the client, so therefore I'm getting it myself, as well as providing massage. I'm also receiving touch by being the massage therapist. But while we couldn't do that, that was so painful. And so getting back to getting my regular massage again, I go twice a month. Oh, thank goodness. And having the soft, gentle, light touch that is soothing, that allows my body to release and let go. I don't even have to know what it's letting go of. I'm trained in a particular modality called trauma discharge therapy, and it's
Yeah, what we need though also to, I think, to what is important for healthcare, for them to, like, you could not receive your massage. I want my clients not to feel, oh, I feel really bad because I haven't received the massage. We need to give them other strategies, self-help strategies, so that they don't feel that the massage is what they need. So we need to expose them. For me, we need to expose them to, like, massage makes them feel good. Sometimes, I kid you, sometimes I say to clients, you have a bath, it gives you the same, and they say to me, yes, but still prefer being touched. Fine, as long as you know that having a bath will stimulate the parasympathetic nervous system. You don't have to spend £50, but if they choose to come, because it's the experience with you as a practitioner as well, isn't it? That actually to them is really important. As long as they know, to me it's really important, as long as they know that there is no there is no physical need for them to come in. That's why they have to feel absolutely in charge to me. Otherwise, if they don't feel in charge, we are doing them a disservice. And that's why one of the things I wanted to say is that we all trained, the client's needs are changed. You would all agree the client needs are changed. People don't come to us anymore for relaxation. People come to us because they want injury to be treated. I'm not going to even go through here the different scope of practice or whatever. In the moment, to me, in the moment in which we work with people in pain or suffering, and that I put in so many, it doesn't have to be only an injury, a musculoskeletal injury, pain or suffering, that to me, those people requires a higher responsibility. There is a higher responsibility that falls on our shoulders. And to me, the responsibility needs to be taken really seriously. We're not in leisure anymore where we treat just for relaxation. In the moment in which we accept client for pain, it means that we have to up our game. And it is now, evidence-based practice is not just a nice word. It's what in healthcare they do. Some healthcare practitioners do it better than others. But this is what has been done since the 1990s. The nurses do that, the chiropractors do that, the physiotherapists do that. So when we get upset that we might not been able to open over the lockdown, or that we are not at par with physiotherapists or osteopaths, don't even consider the fact that they all go to university for 4 years and so on. But in terms of provision of care, until we actually start in applying some evidence-based practice, we will never be listened by. We will never be taken seriously by. And I think we don't have to have a degree to be taken seriously. That's why, again, I'm a great advocate of vocational qualification, because to me, brings me the people that they got compassion, they already have a life experience behind all of that. And I think, for example, of course, it's 12 months. I'm really happy with that. They don't need to be any longer. If somebody doesn't want to go university, we are a little bit the middle ground there. We can, qualify really good practitioners. So we don't need to go university. But what we definitely need to do is to take our responsibility to work with pain seriously. And to me, that coming seriously is starting looking at evidence. To me, we are at a point where we just cannot, how do you call it, avoid it anymore, or turn back anymore, isn't it? We just can't.
Do you think that we, in some ways, have a little bit of difficulty with certain things that we know that massage is good for? So say, for example, there you're talking about people in pain, and if also we speak about people who have got poor mental health issues, and we know that massage helps for depression. Is there a reluctance? Because if, on the one hand, we're trying to get people to, have self-efficacy with pain and also obviously with injury if we can, but with mental health, that's a little bit more difficult to achieve because we probably don't know enough about the subject. And so therefore, going back to Leslie's point about who actually advertises that massage is useful for mental health, are we reluctant to do that because that we are not
We don't have
quite
the
sure?
skills. Yeah. Because actually what you're treating with mental health, you're not treating a mental health issue.
Yeah.
So while we can treat according to your levels, while we can treat injuries, so somebody come and injury, I can treat with injury, not only the symptoms, we can treat the injuries, again, according to certain qualifications. But with mental health, you cannot treat mental health. So you're not there as a treatment for mental health, but you can be there as a support for managing mental health symptoms. So while with shoulder injuries, I know that self-efficacy is the best plan of action. With mental health, I don't know. But what I know, that it helps the symptoms of anxiety and depression. So I think I would say, if you want to actually go a little bit more into mental health, then further courses, in fact, I think not even counseling is enough. I think it's a little bit more, a little bit more in depth. So the difference is, while for pain and musculoskeletal pain and injury, according to what qualification you have, you can treat that problem if it's within your scope of practice. With mental health, is definitely not within our scope of practice, and no level, so 3, 4, or 5. But what you can do, you can support somebody that has anxiety symptoms or depressive symptoms if they are underneath care of. So if you pick up, for example, somebody's got trait anxiety or depression, you would refer, you would advise. But if they don't want to take that advice, you're definitely not going to say, oh, I'm going to treat that, because you cannot.
I had a girl in today, really interesting. She's obviously, I won't divulge too much information, but she had psychosis after a traumatic incident where she ended up fracturing her back. Ended up with psychosis while she was in hospital. So she had psychosis for about 3 months. This was 4 years ago, and she's still struggling with the after effects. So I saw her we had a chat first where I didn't charge her, just to make sure that she was happy with what we were going to do, so that she was in charge of what was going to happen to her. So we did our first treatment today. We did it with her clothes because she felt really worried about having to be undressed. And it's just, I think it's just given them, I think like Karen said, it's given that safe space and it's listening. So, even if you don't want to do the extra training, listening can just be so valuable. And I think that's really a massively important part of our job.
We know, so it is in any injury, in any relationship with the people, coming back to what Karen said before, listening is a big part. Some research in primary healthcare shows that a patient, because I was primary healthcare, is stopped within 25 seconds of their opening statements, 25 seconds. And actually they found that quicker more the patient is stopped, and longer the consultation lasts. So, because how many times you think, oh my God, we're looking at the clock, I don't have time to put the client on the couch, and we think, oh my God, it's really all this chatting is really, kind of eating into the treatment. But actually, what is the treatment? Yes, the treatment is the talking, the treatment is the listening.
Yeah, that's something I've really got to get over at the moment. Past few months, I do 1 day of massage from home where the time is taken, there is no rush. and I do 1 day a week in a chiropractic clinic. And that's exactly how I feel of, oh my gosh, there's the paperwork, there's the listening, but there's then less time on the couch. And again, it's getting over that whole, actually, them talking, me listening is just as important as me kind of rubbing the shoulder a bit.
Brava.
But it's still a very difficult
So practically how you,
space to get over.
yeah, and you and your clients. So practically, let me give you a little bit of a practical tip, because
Oh, yes, please.
I was there. So first of all, when a client contacts you, don't say, I don't know, let's say my appointments are 45 minutes, okay? I don't say my treatments are 45 minutes. I say, let's say my first appointment, I say it is 75 minutes appointment. In that appointment time, we will go through a form, which I usually give beforehand, because I want them to sit down and have plenty of time, because it's healing for them. Because in my form I say, you know, describe your pain or describe how this pain makes you feel. So that to me is actually a bit of an exercise already for them. So when they come in, I say, look, we're going to be discussing a little bit about the pain, how you feel, you know, because I need a comprehensive view of you. I always say I profile the person as much as the injury. Then there will always be some treatment, and I always make sure that there is massage treatment into it, because that is what they expect. No matter how much I believe that actually the talking part is the most important one, that's what they expect. So I need to compromise. But what I do, and you sound very experienced, so I'm sure that you will not have any problem to do that. You're starting shifting that subjective that you do sitting front to front. You're shifting the process into the couch. So you're actually seamlessly continue the assessment. So don't divide assessment, treatment, rehabilitation. Actually, it's all one. So the first part, the first assessment, the first, let's call it interview, the first few minutes is for you to understand, is there any red flags? Can I treat? Listen to the client talking about but then all this other information, all the other listening, it can be done on the couch if that is suitable, because sometimes they just want to switch off. But it's really important on your, at the chiropractic clinic or in your marketing, don't say 45 minutes treatment, just say 45 minutes appointment. In that appointment, we're going to go through this, this, and this. Because then you're changing the expectations. Then you might find that actually people likes that 45 minutes treatment. Then you might put your prices up and give a 75 minutes appointment. But this time you charge them £65. I don't know, you know. So think it. Sometimes we need to be a little bit brave, because actually I'm talking about also not only personal experience, feedback from my clients, because when I moved into evidence-based practice several years ago, guys, I had already clients that have been with me for several years. So I had to switch them into my thinking as well. So their feedback was that actually, although at the beginning felt really strange, they actually had the same pleasure, and I used the right word, in talking to me about about what they struggle with because of the pain, as much as the effect of the treatment. So the whole treatment was becoming more pleasurable if there was enough time for the talking.
No, that makes a huge amount of sense. I think because I feel slightly more under time pressure working in somebody else's environment, I think it's finding that fine line. But now you've said that, I've got it in my head going, well, let's carry on this conversation while you're on the couch and take it up from there. So thank you very much.
Yeah, exactly. Absolutely. Exactly. And you'll see that then, you're starting valuing the subjective. Again, evidence is telling us that the initial interview, it's really important. And the other thing that is really important is that if the client gets a pain release out of the first treatment, they seem to have better outcome for the injury. That's why massage works, because no matter what, guys, unless, you know, remember Stevie, one day you posted about something, I think it was you posting about really deep and sports massage, bruising or things like that. That is not, to me, that is assault. But, you know, a little bit of discomfort during massage is acceptable. But actually, if people comes out of the treatment and they feel good, or they relieve the pain, because massage actually is a pain modulator, for us, we know already that the injury there might be more possibility that the injury will, they will self-manage the injury better, and they will be better if we give them the exposure, that's the right word, exposure to pain relief from first treatment. Because I think they all come back, not because of what we've done to the shoulder, you all come back because they're gonna trust us, don't they? If no matter what we say, if actually what we do relieves the pain, is giving them two great messages. One is that they trust us, that they know that we know what we're talking about. Secondly, they actually, and this is up to us to let them know, if I can relieve the pain within 20 minutes touching you, it means there cannot be something really wrong with you. It means that I will not change your near osteoarthritis in 20 minutes. I cannot change the tissues. I cannot change the fascia. I cannot change all the structures. So it means that I'm affecting something else. That is a powerful message to them. That is and they say, oh yeah, you're right, actually.
Also, can I say something before I forgot? Can you hear me?
Oh yes, we can.
Yeah. Oh yeah, before I forgot, it's a bit, might be out of subject. I don't know, read it sometime on one of the groups. And it really, I started saying, you know, you always get those clients who need some kind of validation or confirmation. And we have those questions. Oh, I'm the worst you've seen? Is my shoulder the worst one? So I read it some time ago and I'm using it and say, it might not be, but you definitely deserve to be here, because people have that guilt, you know, guilt of, and feeling selfish because we feel, oh, I'm not deserved to be here, like I'm doing something for myself instead of doing something else. No, you tell them you deserve to be here and change the thing for them, you know?
Yeah, I love that. Sometimes, and again, I think Bronnie Lennox Thompson said that when a client says to you, and again, you know, you're all practitioners, so you all heard that, oh, I can cope really well with pain, but this is beyond. They're trying to tell you, please listen to me. This pain is really, really, really deep. Instead of us saying, oh yeah, no, you're gonna, you know, it's actually them, they're trying to tell us, please listen to me. Nobody's listening to me. And sometimes just sitting down and asking the question, how does that make you feel? You know, how would, I often use what we call the ruler technique. So 0 to 10. And so, you know, how do you feel? Well, today I feel 6. You know, I don't feel that great, so I feel actually 4. And so why didn't you say 8? Because my shoulder is really painful. Okay, so you didn't say 8 that you feel great because your shoulder painful. So why didn't you say 2? Oh, because yeah, my shoulder is painful, but actually I still can go and row with my mates. So, oh, you see, you know, it's not, you know, you're still a 6, but, you know, it could be a 2, really. So to make them, to expose them to that differences. I know that today you feel it really, really deep, and it's really painful, but remember, you know, you might be a 2 instead of, so those are little strategies of motivation interviewing, which is really, really useful. So I think we're coming a little bit on a close. Is there anybody's got any questions or anything that they want, even if you know, any questions about what you know, how we do in practice, or any strategies, or anything about evidence-based, about pain science, that you're curious, that you might have thought, oh, I just always burning to ask, but I never dared, because sometimes in forums, yeah, go Lisa. Sometimes in forums, we all feel a bit, in a forum, we all feel a little bit, oh, what about if I say something wrong?
I was wanting to ask, I mean, I do, because we are in business, and I don't want people to be dependent on me because they're unable to treat their own pain, but equally I am here to earn a living. So selling myself as a evidence-informed practitioner, how do I sell myself? Because I can't say a massage, you know, the trade things, that because I've been doing it 25 years, it improves in circulation, it does things. I want to say that, in fact, my tagline does say I help to improve your physical and mental well-being, because I help you in life, you know, I support you. But it's kind of, you know, and especially with social media, there's this kind of almost this machine to feed that you've got to say, you know, and trying to be evidence-based, I find it difficult to kind of feed that machine as to what to say all the time, kind of thing. So I'm just not quite sure how to, kind of hearing everybody speaking today kind of makes me think even more about stuff.
Oh, what a beautiful question, Lisa. What a beautiful question. And that is a controversy that everybody goes through. You're absolutely hit it, you know, really, really pragmatic question, actually. I would say, first of all, in terms of marketing, and I come back from a marketing conference that we did, the Therapy Live business. It was amazing. So do not sell your services. So do not sell your therapies, you sell an experience. So what you're selling, it's, you know, we are there to ensure that, to support you through your journey to health, to journey, like for me, to musculoskeletal health, or to make you think about what clients you have. You've been in practice for a long time, so you know exactly your demographic. You probably might have two types of demographics. Look at your demographic. So let's talk about the over 60s. What do they want? They want to move better because they're stiff. They want to continue the golf and their activity that they retire, they want to do. And they want to be pain-free doing that. So enjoy life to the full. So this is what you're selling. You're selling pain-free movement, for example, okay? The gardener that comes in at 6 o'clock at night, or the rugby warrior that goes at 45 years old and they think it is 25, and they go and play on a Saturday and they come to you with a knee painful on a Monday. This is what you're selling. You're selling them the ability to still perform at the best. For example, the ability to work, you know, to be able to be strong for their daily activity, for their work. So you sell an experience to them. Like, give you a simple example. My husband is got a pizza van. He's English, but he's got a pizza van. We don't sell pizza. We don't advertise as selling pizza. What we sell, a night off from cooking. You see what I mean? We are selling the experience. So first. Secondly, you can say, I am, you know, my approach is the approach. So you're not selling the massage therapy. You're not selling the reflexology. I don't know if you're a reflexologist. You're selling an approach, a manual approach to all those experiences. So you help those people achieve that by using, for example, massage therapy. And the other thing, talking back when you said, Anna, I don't want to make them dependent, but running a business, yes. And I'm proud to run a business, an ethical business. So I think the money can go hand in hand with ethics. 100%. I have no problem with that. What I would say, that's what I said it to you, what I said before. I still see clients coming to me weekly or every other week or so for massage therapy, but they are absolutely sure that that's what they come there for. They choose to come there for that. So if you come to me for a shoulder injury, I tell you that might take 4 to 6 weeks or 6 weeks, whatever it takes, or I need to refer them if they don't get better. Even when I refer them, I say, you can still come to me for massage therapy if you want, to make you feel better. So you can still get, and you will find that actually you are allowing people to say, actually, do you know what? It's okay to have a massage just to feel good. You're giving them, Becky always says, sometimes it's giving them permission to just come in to feel good. And you say, you know, there is great value for you to feel good. So, and they can come on a regular basis. Because, and this is what, you know, I taught a class at the weekend, one of my introductory courses. And one of the things that banged on about is the benefit that people experience. Nobody queries that. Nobody queries that you feel you move better, that you feel taller, that you feel nicer, that you feel much more, let's call it, you know, somebody said grounded or more relaxed or muscle tension. Those are, who are we to say they don't feel that? This is a lived experience of the person. What we now know differently, that those benefits, they are created by things that from different mechanisms that we knew before. That's it. Absolutely, that's it. Nobody says that the manual therapy is not good. And this is what we're that. This is why we are so strong advocates of manual therapy. And I run a clinic, so believe me, you know, I would not be running a clinic if there was not if it was not wise to advertise evidence-based practice. In fact, I would say people like that. People like to know that you're not only looking at your experience, people like to know that you're actually looking out there for what the studies are proven or not proven, or supporting or not supporting. Yeah, Sarah, we're so, yeah, you're absolutely fine. Yeah, in fact, Sarah, you're top. We're selling a solution for the pain. This is what we need to make them understand. We're selling a solution for the pain. And the solution, which is, you know, self-management. But they still will come to you because they do not, we are exposed to certain things. Like people come to me to say, oh, actually my golf swing, oh, Anna, I just got really, really, really stiff, you know, for my golf swing. Okay, let's go and expose you to movement that might improve that. Or I advise them, or support. I don't like the word advice. I always give the word support. Things that they will know themselves, might not know about. But that's my profession. That's what they pay me for. That's why I research about golf, or I research about osteoarthritis. So feel absolutely free and be totally proud to, but sell, this is one of the really good things, sell a solution and know your services, because nobody cares anymore about massage therapy, reflexology, doesn't it? Neck pain, sciatica, not people. And somebody said, and I'll stop there, I promise, I'm not gonna, I loved what Ben Cormack said. He said, people don't come to us to have pain relieved. People come to us to achieve back the function that pain stopped them doing. So they want to go back to do their golf. They want to go back to be able to sit down. They want to go back to be able to play with their grandkids. And that's quite powerful, I think.
Be the cure to their headache.
Or support them to give them support strategies so that they can cure their own headache. And the other thing that I would recommend everybody, you know, we're becoming much more switched on with Zoom, apart from me, obviously, because obviously tonight between the Zoom and the, what I think is would be very nice that in your local community, you can do a very simple chat like we did tonight. And a couple of PowerPoints, very easy, or without PowerPoints, or you can do it within your clients, because I'm sure that plenty of your clients will be in Zoom. and just talk about, for example, we're going to do one soon on pelvic health, another one on osteoarthritis and pain. That's a good marketing for you, while at the same time, what you're doing, you are educating your local community. And you're putting yourself above those other people that just say, come to me, come to me, come to me. That is 1 hour and a half of your evening, but how powerful that is, giving those people that, oh, actually, I didn't know that. That made me feel so much better. They associate you with, oh, that was great. That was such a positive chat. I feel so much better now about my knee, knowing that that association will always be there. So, any other questions? But feel free. Listen, if there are no, I hope you enjoyed it. I wanted to. It was a bit shady as at the start. I wanted to make it really, really relaxed. So I didn't prepare PowerPoint or anything, and I don't think you need it. You don't need to be educated. We need just to chat it all together and see, you know, what the best options. But feel free to ask any questions on the group. And yeah, contact us, contact me. Feel free to contact me on Facebook, on DM me. Might not reply for a day or two, but I usually see messages. And feel really, and the group where you are, the massage therapy, that's a really good group. It's quite safe, so ask questions, and it's a great journey to go into. And Leslie said something really nice, actually. I would love an evidence-based therapist UK listing thingy. Oh my God, that's yeah. That's a great idea. Yeah, that's a great idea, actually, having a listing of evidence-based practitioners. That may be something we ought to be doing. Okay, great. I hope you enjoyed it. Please send me feedback. And if there is anything else like this that you want to run in the future, it's an hour in the evening. It would be really, really nice. Okay. You take very good care. I'm gonna bye everybody, and I'm gonna switch this one off.